Okay, you're good to go.
Here we're good to go, and I don't know if the volume thing has been fixed or not, so if you have trouble hearing, let us know. Thanks for the opportunity of presenting again at the invitation of the municipality. I do appreciate the effort that goes into these presentations. A lot of time has passed. It seems like 10 years since we had our first chat about this virus business, and we specifically want to review some functionality of the Assiginack clinic today, which is the point of talking to you, but I thought we'd take some time just to recap and catch up, because we've learned quite a bit over the last 3 months since we first started talking to you about this. This virus is obviously now here, whereas in the early presentations we were just getting warmed up. We've learned, yes, this is a new coronavirus. Yes, it is spread primarily through droplets, so when people speak, but some think it can linger in the air up to 3 hours in certain spots, particularly indoors, obviously. Outdoors, the wind would blow things away. So there's a question, could this have some aerosol spread as well? What we do know is it spreads incredibly easily. There's no doubt about that now. And the worrisome feature of this virus is, ironically, that some have very little symptomatology or none at all and can still spread it. And just because those folks don't get a bad infection from that particular virus doesn't mean that you won't get it from that particular virus. So again, that's the trick of this thing, is asymptomatic transmission. How do you fight this thing if you can't see it? SARS-1, if we recall, presented with symptoms almost all the time. So we could screen, we could check temperature, fever, etc. This one we can't, particularly in the younger age groups where there's a lot of asymptomatic spread. We know it gets in our eyes, we know it gets up our nose, we know it gets inhaled into our lungs, it could get into our gastrointestinal tract as well. This particular infection is interesting. It does a lot of different clinical things, I think we've seen. Initially, we thought this was all going to be a respiratory virus, and it certainly has that component, and that's the primary way it gets into the body, but this is an endovascular virus. So what does that mean? All through us, we have blood vessels going to every organ, and these become smaller as you get into the meat of it all. And we think this thing is inflaming the vessels of not just the lung, but many organ systems. So we've seen people with seizures and delirium and mental changes. We've seen weird rashes, particularly in the kids. We've seen that weird multi-system inflammatory syndrome, thankfully rare, in the kids. We've seen the COVID toes since then. And we've heard about the people that just have diarrhea and vomiting, or all of the above. So this is not like your usual influenza type infection. This is its own beast. We've learned that it causes a lot of clotting in those who are quite ill. We've learned that it can cause what's called a cytokine storm, where your immune system gets really ramped up and ironically hurts you in the process of clearing the virus. And this has relevance in terms of vaccine development. Right? We want it to be safe. We want it to not overstimulate the immune system. We've got to find that sweet spot, and we'll talk a little more about that too. So we know the thing doesn't walk, fly, or swim, so the only way this virus gets from one person to another is via that person and their droplets or the surface contamination. The tools we have to deal with this haven't changed, and I think as we get longer in this process, people are getting tired of the new normal, if we can call it that, meaning normal. And we're letting our guard down, in my opinion. Nothing's changed since 1919. Physical distancing, right? Get 2 meters apart, or 1 cow apart, or however you want to measure it. If you're sick, obviously stay home. Initially, we had to message that, but I hope to goodness now everyone who is ill will not venture out in public. Wash your hands, wash your hands, wash your hands, wash your hands. This is the most I've washed my hands in my whole life. And face covering. Now, this seems to be getting a lot of people really wound up for some unknown reason. This is the most political disease I think I've ever dealt with. And I think it all stems from our fear response, our denial, or some are just tired of having to put up with this stuff and would rather just get it over with. And I do understand that to a degree. Face covering definitely helps. Is it perfect? No. Nothing's perfect. Does it help? Yes. Is it hard to do? No. The human species, which I'm not particularly fond of because I find it slightly odd, will put all manner of head coverings on at any point in time and nobody seems to care. But as soon as you put it this way, they get all freaky. I don't understand why. We've talked about N95 masks and their requirement in hospitals for procedures such as intubation, and our hope that those get preserved for the hospital staff. Are they the best? Yeah, they are. So it's not a message to say that, well, we get the best and you guys just get this stuff or whatever you get. It's allotting the resources where they're best used. I prefer these actually over the N95s. They're pretty close. I don't know if I'm either allergic to something in those other masks, or it's very hard for me to tolerate it. And in fact, now I've been told that they don't make one that fits me perfectly anyway. So I'm hoping our snorkel mask, again, thanks to Bill Cranston, gets approved and we can get those virus filters in the snorkel mask, and then it'll be looking really weird in the LCBO, but I don't care. So I do encourage people, if you're in a building such as this, and if there's a bunch of folks, yeah, it can be in the air. Yes, it can be on the surfaces. Please consider face coverings for indoor use. I understand some people can't tolerate them, some people are asthmatic, some people are allergic, but those aren't that many people, and it's not that hard to do. If you do that, if you wash your hands, if you clean your credit cards, if you just keep the mentality that you just have to be careful, not scared, careful, we're going to do better. This virus is not here until it is. Hello Kingston, and great response on your catching of that cluster in the nail salon. I'm not sure what goes on in a nail salon, but there it was, and here we are. And now I hear we're up to 27 positives from that little cluster. One of which is healthcare, and one of which is in the prison system, so who knows where this is going to go. Think of this like you would think of inflammable or flammable material. Fires starting here, there, or wherever they start. This virus we can't see without testing, and today I'm pleased to bring to you the fact that we can now start doing some testing locally. This has been my wish from the get-go. It's my belief, again, these are just my opinions, nobody else. I don't speak for the hospital or the clinic, just my mutterings. It's my opinion we just were caught flat-footed and we did not have the capacity, reagent-wise or lab-wise. Apparently now we do to some degree. So I want to introduce local testing of asymptomatic people. Obviously symptomatic people need to be tested. That's a no-brainer. But there are certain groups that are at increased risk of having this without symptoms, and that includes and starts with your healthcare team. So we've decided on a schedule of 3-week swabbing of ourselves to keep looking for those silent sentinel cases. I would extend an offer to any businesses in town that obviously are face-to-face with folks on a regular basis to offer them asymptomatic testing. And deviating somewhat from our own patient population of Assiginack Health Clinic, we would like to encourage people who are summer residents staying in Assiginack, such as campgrounds, etc., or resorts. If you would like to be tested, we will find a way to make that work. Again, this whole issue of tourism and cottagers, or campers, I guess you guys say in the north, it's not personal, it's about the virus. And the virus comes from one spot to another. So particularly if there is a hot spot you're coming from and you want to get swabbed, we will find a way to make that work. In many ways, that gets you out of your 14-day jail isolation thing a little quicker, potentially. And I think most people would like to know. So we don't want it as a barrier that your own family doctor isn't present. Now, why can the hospital COVID assessment centers not do this? Technically they can, and they're still in operation. But I don't see that it's feasible that the hospital can carry this load on its own, and I appeal to primary care, which means your family doctors and nurse practitioners. if we could somehow step up a local solution now that swabs are available. And that's presuming they remain available. And right now we still don't know exactly how many we're getting and how frequently. So some of the details will need to be worked out. What we're going to start with is a Tuesday offering from 11 to 2. That might change. Stay tuned for the messaging. But roughly over the lunchtime, so hopefully convenient to folks. We're going to do it outside at the Assiginack Arena in the, is it called the vestibule, the carport drive-through thingy. The reason for that is we still can't process people through our clinic safely in a group. It's just not physically possible. Outside for any activity, particularly swabbing, is preferred to indoor. Sunshine and fresh air and breeze goes a long way to dissipating this virus. It also allows us to preserve our personal protective equipment. So you'll see us there in the spacesuit. We'll have the little yellow gown on. We'll have this probably, and a face shield and gloves. And we will hopefully even do you in your vehicle. It's like a drive-through. We don't have to. We can bring you out and sit you down. But bottom line, the swab itself is no big deal. It's fairly quick. I think it's reasonably painless. I mean, don't think about it like every other test we do to people. I mean, who thinks about the colonoscopy, right? That's where I want you using your denial. Just don't think about it. Show up, get the test done. You'll blink and wince a little bit, and then you'll be on your way and you have a story to share with everyone else who's getting the swab jammed up their nose. And it is a significant size. I'm not saying it isn't, but it's really small, thin, flexible, and really not a big deal. And I'm probably doing myself today, so we'll see if we can film that, and I'll lead by example. Yeah, it's a weird